You're looking at just the kit itself here. I'm going to just kind of show you the basic properties. The working time on it is 2 minutes, and your net setting time, your total time, is 5 minutes. It's got a film thickness, this material has a film thickness of 15 microns and 160 megapascals as far as our compressive strength is concerned. And lastly, if you look at the bottom line, one of the things I mentioned is it has wonderful radiopacity, so it's easily seen on our radiographs at cleanup or post-operatively. Now these are my own pictures of just how this system works. Here you've got on the left-hand side your dispensing unit, and then in the middle is a foil package containing one of the triturate capsules we're going to triturate, and this is the activator unit, which is similar to one of the systems that we've seen in the past. So here we are opening up that foil package. This is what the little unit looks like. You can see inside it. This is a little plastic holder on the side here. Inside here you can see the powder, the calcium aluminate, and then in it is also some distilled water, and we place that in an activator. Here we are putting in the activator. We now push down on this activator handle, and it squeezes these two together, pushing the water into the powder, and that then there we are activating it, and we take it out, and now the powder and water are kind of sitting together. We put it into a triturator, and we spin the triturator for 8 seconds, and then once it's done, we take it out of the triturator, and now we have to turn the tip on this capsule because it's sealed, and what we're doing is opening it up so we can squeeze it out. So we twist this capsule 90 degrees, and after we've twisted it, we then put it into a dispensing unit, and we dispense it into a crown like we're doing there, and then you can seat it. So some of the nice things about this that make this a nice robust procedure is that we don't have to do any special tooth preparation or special isolation techniques. We don't have to completely air dry the tooth, which we know when we desiccate it causes a tremendous amount of sensitivity. We can just cotton dry it. So we will isolate with some cotton rolls. I'll take another cotton roll and just dab dry the tooth, and now I'm able to go ahead, use that nice little angled applicator tip to directly place that cement right into the crown and then seat the crown. Because it's got this low viscosity, it seats really easily. There's no need to tap to get air bubbles out. It just pushes right down. It's a very creamy mix. It seats well. Here we are looking at a crown. This is a zirconia crown with porcelain fused to it, which I think most of us are doing these days. We'll look at the different materials in just a little bit. Here's our crown itself, looking at it from different views. Here we are now with that applicator tip squeezing the material into that crown. There's our prep. We're going to seat that on the prep, just push it into place. The next step that we'll do is to go ahead and take a wooden stick and have the patient bite down. And we'll have the patient bite firmly with the wooden stick for just 4 or 5 seconds. Then we have him open up, and we just check to make sure it's fully seated, to have him bite down with nothing in place. And then we'll go ahead and place a cotton roll and have the patient bite for the remaining minute and a half or so that's going to take for a complete set. The cleanup is one of the beauties of this material. It cleans up really easily. It flicks off. I'm going to show you a little video a little later on how that works, but we'll just, after it sets, take a single Explorer and put it in one of the interproximal spaces and just give a little pop. Do the same thing on the opposite side of that same buccal surface there, and that piece will just flick right off. Here we're showing doing it on the lingual surface.